rested. I expected you to be socializing until all hours at the night, but those of you who are dragging this morning because you stayed up too late having drinks, and everyone else, I salute you for your perseverance. If any of you are in the back wearing sunglasses, indoors, you're my new networking heroes. Seriously, I hope you had an amazing first day and night at the Digital Health Summer Summit. I did, and I learned more than I expected. As you no doubt have discovered, there is no shortage of incredible people to meet, ideas to explore, advice to adopt here. And just as I warned you, it's not just about the notes you can take or the brochures you can read on the plane later. It's the connections and relationships you make here that will help you take your digital health concept or business to the next level. So what did you think of those rockstar startups that Rock Health introduced us to? Yep. Incredible, incredible. There's endless creativity and determination of people in this field. This is a revolution we're experiencing, and these people, and you actually, are the builders and pioneers remaking our whole healthcare system. Well, fasten your seatbelts because day 2 is no less exciting. We dive right in with our opening keynote, and the brochure didn't lie. This is going to be a candid, no BS exchange on some of the most challenging business issues in digital health. From there, we get rolling through a variety of relevant and very, very current topics facing most of you in this room. From the world of digital health apps to winning over both consumers in the retail world and the regulators at the FDA. And of course, we're going to delve deep into the intricate world of funding, explore the herd of realities of healthcare social media, and help you strategize your next move on what we call the digital health chessboard. We're really excited today as we have a really fun interactive luncheon with some great prizes. I'm going to point this out to you, and I'll explain in a minute. Eli Manning Super Bowl signed football from last year. So those of you that have your RX for Success cards that are in your open pocket, front pocket there, make sure to visit each of our Expo exhibitors out there, and they'll give you a stamp. Please get as much information about them. They're doing some exciting things. So I'm going to issue you a challenge right now, and anyone that still has their own business cards by the end of the day owes me a drink. So I will be checking your pockets, and I'm so not kidding. Before I introduce our first opening keynote, a few things, and some of this might be a repeat for some of you, but we definitely have some new faces in the room today. First, I'd like to introduce you to some really important people. I want to introduce you to my partners in crime in putting this whole thing together, Linda Nessum and Robin Raskin from Living in Digital Times. They are quite dedicated in this space, and it's been a blast and also a lot of work, but a lot of fun for us. Second, I want to extend another major thank you. There we go. To our partners and sponsors. Couldn't do it without you. We really appreciate your collaboration and partnership on this new venture to help businesses succeed in the digital health world. So let's start with the most important, and that is Qualcomm Life, who came in to really support us at this very early stage of what we're doing here. And we really appreciate their collaboration as co-host partners and sponsors with us. Platinum sponsor, thank you. Platinum sponsor, United Health Group. Gold sponsors, Good Chime, who helped us throw that great party last night, and ShareCare. Strategic partners, Consumer Electronics Association, Frost & Sullivan, and Rock Health. Few notes. Make sure to network, switch seats during sessions. No seat is dedicated to where you are right now. Also, if you're tweeting, make sure on your table it'll remind you RX for Digital Health, hashtag. And I wanted to thank Misfit Wearables for putting together our first digital health app. Hopefully we'll keep growing that, but please download it. It's at Google Play and at the Apple Store. We would appreciate it. And you can also give us some great feedback and stuff on each session, and it'll help us improve the program every year. And I mentioned the Super Bowl prize, the Super Bowl football prize. Also at lunchtime, we'll be having a great game with some cool prizes. So here we go. Grab your coffee, plop one of those fizzy meds into your glass, or just scoot a little closer and start scribbling. Day 2 starts now. So, with all of the talk of digital health and the surge in companies entering the sector, what are the realities of where this whole business is going? Is digital health doing what it's setting out to do? Well, our opening special keynote session is going to be fun. I want to introduce you to Lisa Sunan. obviously the woman up here, who many of you probably already know. She is co-founder and managing member of Psilos Group, a healthcare-focused investment firm founded in 1998. She focuses on the medical device, healthcare IT, and healthcare services sectors. She also writes a widely read blog on healthcare and healthcare investing called Venture Valkyrie. It's great. You got to go. And I heard there's a great bacon post, so I got to read that. Anyway, bacon, digital health, who knows? She'll be playing the interviewer role today. And next, Mr. Don Jones. He serves as Vice President of Global Strategy and Market Development at Qualcomm Life. He is responsible for Qualcomm Life's development of wireless technologies and platforms in the health, fitness, and life sciences market, and is recognized as a leader in the field. And most importantly, he knows a lot. So I think this interview will really be enlightening to all of us. Thank you.
Okay. Thank you very much. It's great to be here today. Again, I'm Lisa Sunan, and Don and I have actually known each other for almost as long as I've been doing my job, 14 years, because he was one of the first CEOs to pitch me a deal. And at the time, it was also a mobile health deal, but the mobility was walking or driving to people's homes. So he's been in the same field a long time, I know, maybe even longer than that, but different technology. And so my question for you, Don, my opening question is, so what does that mean? What does this digital or mobile health thing really mean? People tend to tie it to cell phones or something, but why isn't everything that has technology associated with it digital health?
You know, I like to take a very broad view of what's mobile or digital health, and so my definition is that's health or healthcare where you are, and that can take on a lot of different faces or fronts to it. A couple other things. We at Qualcomm refer to it as wireless health, but that's because we sell wireless technology, so it kind of
Aspirin
lines
is wireless
up.
health.
Yeah. But we're, whether it's mobile health, digital health, connected health, at the end of the day, it's about, getting information moving and putting it in your hands when you need it. And that also means at the convenience of where you are instead of you necessarily going somewhere else. So with my background, I started off in emergency medical services, and I didn't think of it about 25 years later when I joined Qualcomm that I had been in mobile health the whole time. But we used radios a lot. We used the precursor to text messaging, which was alphanumeric paging. We sent ECGs over the radio waves. We used lots of digital capabilities for keeping track of where our ambulances were. I had 5,000 ambulances across the United States. So when I think back what my experience was, mobile health was actually delivering it to where people wanted it delivered. Mm-hmm. And I think that applies still today. And whether you're using it through cell phones or connected medical devices or some cloud-based services, at the end of the day, it's where people want the services or want the care.
So there's a lot of people in this room that you and I both know well and have known for a long time, and there are quite a few conferences in the digital health, mobile health, whatever you want to call it, space, where a lot of the same people attend, and there's a lot of similar topics. And I wonder, how much does the rest of the world care? Is this important to people outside of the group that follows it closely? Is it important outside of San Diego or San Francisco?
Yeah, I think the answer to that question is yes, and it's probably surprising where the interests are kind of coming from. I just spent 2 days in Switzerland earlier this week, where I was with a group of folks from the pharmaceutical industry, and the entire conversation was about applying digital technology to solve healthcare issues, both from a pharmaceutical industry's perspective, but really from a world economics perspective. And I think when we look at ministers of health, ministers of telecommunications, ministers of finance, the cost of healthcare is on their tip of their tongue, right, in the meetings. And so the answer is it's very, very relevant. Our CEO, when he meets with operators around the world, the conversation often turns to healthcare because they're getting pressure too to say what can they do in the healthcare world. I also think while there's the smaller kinds of conferences where people are very focused on networking, but we're seeing some very, very large conferences emerge. The mHealth Summit, which was put on by NIH of all folks, quickly grew to 4,500 people in the Washington marketplace. And I think that was just a sign of the times of relevancy. And Todd Park's creation of the Datapalooza, which is 3 years old now, I just got back from that conference, 1,600 people, all on app development. They had to turn away about 300 people at the door because of fire marshal concerns. And that has grown from, didn't exist to that size today. So I think that we're seeing signs that this is becoming extremely relevant, but most importantly, it's politically very relevant on the political forefront.
So I recently read an article about the whole mHealth field where the author of the article was trying to distinguish whether the products in the space were essential or merely delightful. And what we definitely know is no one seems to want to pay for these things. Very few people. There's very little revenue coming across in the mHealth or digital health space. So what's the problem? Is this stuff just delightful or is it actually necessary?
Well, let me address that from a couple of perspectives. First of all, I actually think that things need to be delightful to be successful. So in general, whether they delight the end user, whether it be a physician or the patient, you can kind of get into debates about who gets delighted in the process. But in terms of who pays, I actually think there are some examples of very successful companies. Some companies like San Diego-based CareFusion, which spun out of Cardinal Health, $4.5 billion company. Most of their products are wireless. Most of them are mobile in nature. Most of them are connected products. So again, it gets down to the kind of defining what is connected or digital health, whether it's an infrastructure play, like CareFusion's products that are mainly hospital-based, or whether it's a consumer product. You kind of get into these different market niches and the discussion about who's paying. Right now, the strength of the marketplace is to enterprise-based products. And I think this kind of goes to the notion that the average consumer can only consume so many products in a particular category. I kind of refer to it as you'll only tolerate so many buttons in your life. And those buttons control whether they're the light switches in your life or the buttons that control different features on Outlook. You can only remember how to do so many things. And so consumers will only take in and use consistently things that are both delightful, but only in a small measured number of devices or functions. And so it's got to actually work and serve and do something well for them. So my view of the world is that there's going to be far more successes in the enterprise, solutions that actually help enterprises do what they already do better, than there will be really, really big outcomes in the consumer space. That being said, I think there'll be a lot of really interesting companies. They just won't be billion-dollar companies. They may be $100 million companies in the consumer space.
I think it's interesting that you said something has to be delightful to be successful in healthcare, because I think clearly the big successes in healthcare have been the pharmaceutical companies, the insurance companies, and the hospitals. And I'm sure they don't often get called delightful, and yet they've been quite successful. So it'll be interesting to see if you're right on the technology side. And yet, if you think about today, what's still getting bought the most, despite the increasingly advanced IT offerings out there and the more delightful mobile health stuff, and Epic, which is based on, as I said to you, Flintstone-based technology, is eating everybody's lunch. So what's it really going to take for the big players, the enterprises that you mentioned, to actually break through and buy things from people who don't work for Epic?
Well, I think this is actually a great example of the way I think about what delightful means in this case. We look at how fast iPhones and iPads were adopted by physicians. They brought the element of delightfulness of user interface that then was used in conjunction with
that is not delightful, that phone call.
The big iron of health IT. So in a very short period of time, literally a period of 18 months, 24 months, the vast majority of physicians in America moved to smartphones and into tablets to use them in part of their everyday exchange, I think because of the delightful factor that those devices brought. I think what happened to Epic was the delight of the U.S. government dropping $45 billion onto the health IT industry, and that made it delightful.
For Epic.
So I think the reason we're seeing this grand uptake of HIT systems is because there's a stick and there's a carrot out there. Both are pretty big. It's not because the products are delightful. In fact, they're everything but that. And if you actually go back and take the lid off some of these products, you're going back into ancient operating systems and ancient systems and not a lot of connectivity. I think one of the biggest opportunities we're going to see in traditional HIT is delightful applications that come in and sit on top of these systems. There's a great example that was just acquired by Airstrip, a product called Mia, which came out of a local San Diego hospital called Palomar Pomerado, a community hospital. The last people in the world you'd think that would actually develop a piece of software or solution. But their chief innovation officer happens to come from Oracle and from a healthcare background. And he managed to successfully get some funding from the hospital, and they built a tablet-based overlay that sits on top of multiple health IT systems, and now have delivered a delightful interface to really what is a very undelightful environment or system. And I think we're going to see more of that, where the new technologies that are able to provide a time-saving, efficient, easy-to-understand, easy-to-use interface are going to sit on top of the existing kind of legacy systems. And we'll definitely see that in the enterprise space. I think we'll see an opportunity occur for the consumer space when people can figure out how to do these same kind of overlays on consumer devices and give consumers access to information they previously couldn't easily access.
So you think about the payers, and some are represented here. I mean, certainly they've dabbled in the digital health area. Aetna bought iTriage, but mostly it's pilots. Mostly it's very limited. And they haven't gone all in and committed to a lot of this stuff yet. What do you think it's going to take for the payers to get the digital health religion?
It's a really good question, and frankly, I think at the end of the day, a lot of it's going to be driven by the large employers who basically demand it. And we're starting to see some examples. We just rolled out MD Live, and actually went to United and basically United Healthcare and said, we want this service. And in the past, I would say generally when, as an employer, we came and said we want more services or new services, we'd get pushback from the carrier. Even though we're the customer, we get pushback and say, we don't really want to do that now. Today, I think the attitude's changing. They're basically saying that if it has any rationale to it, then it might be a benefit, and the customer is asking for it. They're much more open to entertain it. On top of that, we're seeing internationally some really interesting examples. So the health services in England and the UK are rolling out a 3 million person trial. Now, I don't think that's a trial anymore. That actually seems like an implementation.
It sounds like a business.
It sounds like a business. So, and that's all built around mobile contact, remote monitoring, and
what's the project? What's the subject matter?
It's all healthcare, all types of healthcare. So it's a 3 million person rollout. Italy is it's not quite the same scale, but it's up pushing into many hundreds of thousands in chronic care. Is actively rolling out right now today. So we're moving. I think Europe especially is now moving beyond trials into actually implementations.
Interesting. Maybe they can help refinance their debt that way. So on the consumer side, I think somewhat unfortunately, a lot of the discourse in the field of digital health has been around the consumer. And I said fortunately just because, by and large, consumers don't want to pay for anything. They don't even want to pay for stuff that keeps them alive, much less stuff that's delightful. Really haven't seen much that consumers are willing to pay for on a sustained basis. By sustained, I mean, not just you buy a Fitbit, you wear it for 2 months, you throw it in a drawer. So what is it out that, what will the breakthrough application be for consumers to pay for, or will there ever be one?
Well, I think this is probably one of the biggest enigmas in healthcare to figure out what the right mix is going to be. And I think the biggest challenge is in the distribution of the product is finding that point in time when you can put your product in front of the consumer at the very point when they recognize the value proposition as to why they need it. And I think healthcare, it's very, very hard to find those points in time. There's a really good example that came out of the personal emergency response business, the Help I Fallen, I Can't Get Up business, which is a 40-year-old business. It's not very complicated. It's just now starting to go through a wireless revolution and becoming mobilized as a technology, but historically it's a phone plugged into the wall with a short-range wireless transmitter. But what made that industry successful was 1 out of 40 companies' effort, and this being Lifeline, figuring out that if they put the product in front of the patient at the time of discharge at the hospital, so the discharge planner presented the product, essentially they hijacked the hospital's discharge planners as their sales force, that was the vulnerable moment. That was the moment when the kids or parents recognized that mom or dad needed this product and they could essentially say, "Mom, you really need this. It's relevant. You need to go home. You need to go home with it." That actually built, quite a decent size company, and that has essentially been, in one way or another, kind of replicated around much of the world, at least in the English-speaking world.
So are you saying it's just a marketing problem?
It's not entirely just a marketing problem, but that is a consumer-based product. It's sold for about $45 a month, sometimes $35 to $45.
Right.
So it is consumer pay for the most part. There's a little bit of Medicaid payment available, but the point is that I think the relevant rationale is put in front of people at exactly the right moment in time, and that's often missing in a lot of the equations of the companies we have. Is they don't have a strategy, or they don't even know the point in time when their product is going to be most relevant to people to present it. Now, that being said, Nike has over 5 million users of the Nike Plus system. So there is a mix. If you have the right brand and your right distribution channels, and you have a product that is delightful for folks, and you bring in an environment that, in their case, includes social networking and peer challenges and even global marathons, virtual marathons, you can drive a product into the consumer channel and get the consumers to pay for it.
But that's a very interesting example, right? Because that's a consumer products company, not a healthcare company. Right. And I think the statistic that I find very interesting is that of the Fortune 50, and I think it was last year, the Fortune 50 included 38 companies that had a healthcare business. Whereas 5 years before that, or 10 years before that, there were only 5 in the Fortune 50 that had a healthcare business. And all of those companies are consumer products companies, basically companies that are not traditionally thought of as healthcare companies or IT companies. So I think it's interesting. I mean, it suggests to me, and I'd be curious to your thoughts, that the way to succeed in the digital health market is not to come from healthcare, it's to come from somewhere else.
I think that's probably going to be true more often than not. I think it's, if you come to the table with a lot of the biases about traditional healthcare, you either won't give yourself permission to act in a way that would be rational, or you won't necessarily take on the healthcare environment in a way that probably needs to be taken on. So I think a great example out there exists in the form of a company called ZocDoc, which took on the challenge or problem of making easy physician appointments, kind of open table for physician appointments. This is a company that had to do a back-end technology integration with practice management systems so they could see the openings. But at the end of the day, it's a yellow pages model. It's an advertising model for physician practices with the advantage of filling empty slots really on a moment's notice. So even as slots become available during the course of one day, they can be exposed to lots of people and potentially become filled. And physicians see value in that, and physicians are paying for that. So they found a piece, but the founders of this weren't healthcare folks. They were IT folks who basically said, we can bring an IT solution in here, we can monetize that solution, and we can kind of come in over the top. Now, what I think is going to happen is they're going to become healthcare folks. And what I mean by that is they're going to actually recognize that now that they own the relationship with the consumer, they're going to find other ways to monetize that relationship. And this is just my personal opinion. I think it'll probably come around in the area of labs and imaging. When the physician says, okay, you need this lab work or you need this imaging services, well, I'm going to turn to the same program to find out where I can get the most convenient and the best time for my CT scan, my MRI. And while I'm at it, I suspect United Healthcare or WellPoint or Aetna is going to come along and say, why don't you give us the best price? So essentially, why don't you create the eBay for MRIs while you're at it? And all of a sudden they can take a slice of that transaction. So I think they will be looking at the world of healthcare, but through the eyes of an IT kind of Amazon Kindle-like environment, where they're basically saying, how can I disrupt the current market, provide convenience and delight for the users, and at the same time take a piece of the action along the way? That didn't come out of healthcare people. That came out of people looking at the world through completely different eyes. True.
So now to speak out of the other side of my mouth, a lot of times when you walk into a healthcare company to sell them something, or if you're building a healthcare company, and if you don't have a really deep understanding of the regulatory issues, the reimbursement issues, and all the other stuff that goes on in healthcare, you're dead in the water, right? So being out from outside of healthcare is also a big disadvantage in surviving in the healthcare field because it is so weird and thank God, unique.
You know, it's a scary environment. I got into healthcare without knowing anything about healthcare many years ago, and didn't know enough to know that it was supposed to be a scary environment. I think it's a scary environment until you just get in and do it and then realize, hey, it's not so scary, it's just different processes. I think, for example, working your way through an FDA process, I'd say 9 out of 10 companies that come to us that have never done to it are afraid. They're trying to work their way around going through an FDA process. When in fact, more often than not, they'd probably be better off embracing it. Because the credibility, the stamp of approval, that good housekeeping label that says I'm FDA approved is incredibly valuable and almost inevitably a requirement of some of the distribution channels they're going to try and go after. So in other words, you're going to, as you try and sell the product, the first thing people are going to ask you is, are you FDA approved? Right. If you can't say you are, you've got a much bigger uphill challenge to sell that product through that channel. So I think it's just one of those things, you have to do it. I remember years ago there was a little company out of San Diego that built something called the Pill Phone, which was literally just took the content out of a consumer version of the physician desk reference called the Pill Book. It had been on the market for 20 years. They digitized it, put it into a phone app. It was pretty simple. They went to the lawyers, and the lawyers said, does it belong in the FDA? Does it not? We don't know. We can make both arguments. They went to the FDA and asked the FDA, and the FDA said, yeah, we think it probably should be regulated. Sure. Now, the book's been on the bookstore shelves for 20 years, and the FDA never said anything about the book. So why is it different in digital form? At the end of the day, they went through and got it FDA approved, and that made all the difference because then the operators, the carriers, companies like Verizon, which was their first, said it's fine if it's FDA approved. We'll put it on the network. We'll put it in our library, in our app stores. But without that, they would have never gotten there.
Yeah, no, I think you're right. I mean, I think there's an advantage. It's a pain in the neck, no doubt, to work with the FDA. As somebody who works with a lot of medical device companies, it can really extend the time to market, extend the cost, and all the rest. And that is a challenge. But it's certainly a competitive advantage once you've been there. If you've got the stamp of the FDA and you've survived the process, it's very hard for some guy in a garage to build an app and start marketing against you.
It's not always required. I just think it's worth seriously taking into account that you may actually want to go through the process. Right. And I think once you've been through it once, you realize it's a pain, but you may want to continue to go through it. And I think the disadvantage in software is, and even some of the medical devices that are more based on consumer electronics, you're going to be in a constant state of perpetual submission to the FDA.
Just new, take that in any sense of the word, I suppose.
But so that's life. That's just the business model you adopt or buy into. But I think it gives you a great deal of credibility, market credibility, and a great deal of competitive advantage.
You and I are probably the only two that think this. You know that, right? Yeah, and it's interesting because I actually think that the most advanced type of products in the space, if you think about digital health in terms of the newer companies, and not like CareFusion, but although there's a similar example, the most interesting examples and the ones that are getting funded right now are the ones that have turned the phone into medical devices. You look at like an AliveCore or Airstrip or some of these others, CellScope, the ones that are medical devices. They are in fact, no way to argue about it. So I think that's interesting and maybe that's just a function of what investors are comfortable with, something that's more like a medical device than an HIT deal.
It's not only the investor side, it's also the buyer side. If I'm Airstrip and I'm trying to sell a big hospital or a big hospital group and chain and can't say that this has been independently vetted, which the FDA effectively is providing you that independent stamp of approval, that vetting process, then your whole purchase process is going to be dramatically slowed down. And so I think Airstrip's a great example. They've gone from 0 to 100 miles an hour here with over 500 hospitals, either implemented or contracted in a relatively very short period of time. Number one, because they are FDA approved, and number two, because they have a product that actually saves physicians a whole lot of time and improves their lifestyle. It happens to have a nice little quality improvement. And for those that don't know the product, it takes the data from hospital-based monitor machines and ICUs or ECG machines or maternal fetal monitors and puts it on smartphones and tablets so when the nurse calls, the doctor can see the information. The reality is it's a lifestyle product for the physician. It answers the question of whether the doc has to go back to the hospital or get out of bed or put the fork down.
Leave the golf course.
Leave the golf course. So the docs are going to demand it. Once they see that efficiency, not quality, efficiency, they're going to demand it, which puts the hospital in a position to say, well, I guess we have to buy it. And why do they have to buy it? Because if the hospital across the street gets it, the docs are going to bias their admissions across the street. So there becomes a competitive arms race. And so that's a really interesting combination. It's a product that you have to have if your doctors are demanding it. The doctors have to have it because of the efficiency side, and it creates a competitive arms race between hospitals. So what's the remaining thing? Has it been vetted? And what the FDA provides is that vetting seal of approval.
Right. So I wrote an article a while back. It was actually after the mHealth Summit in Washington with the 4,500 people, where I was amazed by the amount of activity at that thing. But yet I walked away from it, and I wrote a piece that I know is Jack Young's favorite that said that I could only think of one company at that time, now I can think of two, that have hit $10 million, new companies, new digital health crop of companies that have hit $10 million in revenue. One was Patient Safe Solutions, one I know is Airstrip. What's the problem here? Why can't anybody grow? And who else is in that category, if anybody?
So I think there's actually many more. It kind of, again, depends on your definition of mobile health. I think the original mobile health company, CardioNet, was in that category as well. We're seeing in India the top three operators selling through telephone services, through cell phone services, access to physicians, essentially primary care physician visits by making a phone call to a specific premium phone number. So in other words, you're paying for the physician visit by dialing the specific phone number. So it's
like
very
phone
clean.
Medicine instead of phone sex.
Yeah, exactly. It's kind of a 1-900 number kind of version. And but the uptake from the three operators launching just literally over the last, I guess it's now about 8 months, has been phenomenal. I mean, we're up in the 50,000 users a day category. So revenues, and look what's happening here. The operator's booking top-line physician services revenue, and then taking a piece of that revenue and paying it back out to their partner physician groups. That kind of growth where another industry recognizes they can book part of that $4.5 trillion of healthcare revenue and be part of the distribution for it, I think we're going to see more and more of. And that's just another example of something, say, that's going to grow very, very quickly. So I think
if you think about the U.S., that sounds like something that increases costs, not decreases costs.
Maybe, maybe not. I don't. The interesting.
You're adding an intermediary between somebody and getting healthcare and not getting healthcare, and preferably you're adding, and also you're adding people getting access to healthcare that didn't before, so you're adding cost.
Maybe. I think the question is, and you don't really get to do a double-blind study here. Do people not, if they solve a problem with a phone call, do they then not seek out more expensive care at the urgent care or the ER? In some cases, the answer is probably yes. At the end of the day, you're in the venture capital business. If it's a good idea, you're going to fund it regardless of what it does to the top line of the healthcare. If it actually serves a market and meets that market need and can grow, it's probably going to be evaluated independent of what it does to the total top line dollar cost of the U.S. healthcare system.
Actually, no. I mean, our firm specifically was founded to do the exact opposite of that, was to find companies that actually can demonstrate they reduce cost of the healthcare system. And at the time when we started up in 1998, that was pretty weird. I mean, people thought we were kind of stupid, but turns out everybody else is stupid now too, and it's kind of doing the same thing. So it's really become, I think, in many firms, many investment firms, a hoop you have to jump through. Show me how it saves money.
Well, maybe I'm too optimistic, but I mean, you can wait around to do the clinical trial to actually show that you've actually saved the cost. But I generally believe in the consumer market, if you can answer the question they have and get them the resources they believe they need at a time and convenient way, considering that most of healthcare is delivered in a way that's neither timely nor convenient, including trying to get into your doctor's office. If you can answer those questions, get them what they need, then they won't seek care at what will otherwise be a more expensive venue for a lot of the routine, mundane. This has nothing to do with open heart surgery or trauma or the heavy procedural stuff. But for the routine stuff, I think it's just rational to believe that if you can make things more convenient, you will shift costs downward, not upward.
So ABI Research published a report last fall or winter, I think it was. It said that the mHealth market was going to triple to $400 million by 2016. And as a venture capitalist, for me, that's like a big yawn. We want each company to be worth $400 million, not the entire industry, right? So do you think this field, and again, I'm not thinking about the old companies that are already there, but the new companies trying to emerge in the mobile health space, can they be venture backable? Should they be venture backable? Should somebody invest in ZocDoc at a $750 million post-money value, or put 20 million in or 10 million into LiveCore? These companies, can a venture firm actually make money in this space if the market size is going to be $400 million in 5
Well,
years?
at a post money of 750 million, I'm not sure I'd want to be entering in the next round.
The last one's suspicious.
But it would have been nice to be in the first round.
Yeah, I suppose. But it only matters when you sell or make it public.
This is going to be a big challenge for companies that are building a standalone product where they're fighting for distribution and brand. But I think I was just doing some back of the envelope calculations. So Walgreens, they developed an app. It's not a venture back, but they developed an app for managing refills.
Right.
And they stopped reporting on how many people have downloaded it, but let's just assume they stopped reporting in the 4 to 5 million range. So and that was months and months ago. So let's just assume for a moment that maybe 10 million users have downloaded that app, and that they're using it to do their refills for the average number of prescriptions, which happens to be 12.6. Times the average cost per prescription, which happens to be about $77. So you do the math out here, and they've locked in potentially $7.7 billion of prescription business. Not insignificant.
Right.
So the question is how do entrepreneurs potentially tap into that market? What I'm seeing is a couple of ways, obviously, of doing that. One is just be an app developer and specialize in the healthcare field. That's probably not necessarily a venture backable kind of solution. But what we are seeing is some solutions that are targeting a specific industry, like targeting the pharmaceutical industry or the clinical trials CRO industry, and solving some of the very high cost-based infrastructure problems that are in those industries. And in those cases, I think there's plenty of examples of venture-backable kinds of companies. But they're usually solving infrastructure costs where there's very, very high costs.
So your point is, and recognize you have a slight conflict of interest here working at Qualcomm, that the real opportunities in the infrastructure, the pick and shovel business like they used to say back in the internet days, or the gold rush days, as opposed to the app business?
Well, in some ways, being in the guns and whiskey business is a nice place to be. You can kind of sell to all the combatants and sit back and watch and let things turn out. So I think being in the infrastructure space, one way or another, is in the healthcare space, is maybe the boring side. It's not necessarily the sexy side, but you have a lot more customers, and there's often a bigger monetization problem you're trying to solve or lower the cost for. In the consumer world, you've actually, in many cases, you're actually trying to not only establish a new brand, but a new function, something people may not be used for, and that's hard to do. So I think the biggest key challenge for that industry, and where we'll see backable companies, is when the companies have a distribution and brand strategy that actually potentially could scale. And I would think more often than not, when companies come in and see us, they don't have that. They haven't solved that problem yet. They may have a cool idea, but they have not come in with a distribution strategy that says, okay, if this does take hold, if people fall in love with this, how can it scale quickly? So who are the right partners at the table? Who are the right strategic investors that ought to be in there, because they may bring distribution to your company? And so I think more so than is it venture backable, is there a distribution channel, and perhaps more so than ever, the need for strategic investors to team up with financial investors, I think, is stronger than it's ever been.
Yeah, I really agree with you. It reminds me of the adage, if you build it, they will come. That is what we often hear when companies come in to pitch us. We have something so cool that everybody will want to buy it. I've heard that story before. It doesn't usually end well. So it's really a cautionary tale, I think, for entrepreneurs, so that they come and talk to investors, whether strategic or venture or whatever, to be able to tell that piece of the story about distribution and sales and marketing. And I think it's too often left behind to the technology story.
The other element that's often missing is that there's often a piece that's just one element of a consumer's life is being addressed. And if you sit back and say, that's really interesting. That's an interesting piece of technology. That's an interesting problem you're solving. But the reality is the problem's bigger than that. And I like to describe, one of the biggest problems that I've not yet seen a good example to solve is, mom's job as being kind of the medical CEO of the household to answer the question, what do I do next with a sick spouse or sick kids? And so historically, mom has had a telephone and a mercury thermometer as tools. So the question, I think, is an open question, open opportunity, is what tools could you arm mom with that kind of is the Swiss Army knife of solutions that allow her to have a better discussion within the family about what we should do next, and or a better discussion with a healthcare professional about what do we do next. Hopefully, with some cases, the answer is I don't actually have to pile the kids in a car and go anywhere. Actually, we can get this resolved, a prescription can be called in, etc. But what is that tool, what is that set of services that makes mom's job easier, that go beyond the tools she's had for the last 100 years, the telephone and the mercury thermometer?
As a mom, I think the answer you gave earlier, guns and whiskey, is the right answer to that question. One of the other problems in this financing this field is the fact that there must be at least 45 million, or maybe it's 50 million, fitness apps and an equal number of care management apps and diabetes tracking apps, and they all look the same. At a certain point, vanilla is vanilla is vanilla. So it seems to be very difficult to create barriers to entry. Maybe the FDA helps that a little bit, but how do you pick a winner?
That's interesting. It's a tough scenario, and I actually think you have to look beyond the technology. You have to look at what the story the technology drives. Mm-hmm. I think Nike, going back to Nike Plus story drove a social network solution that engaged people with peers, peers that they may have never met or ever have talked to. And that real story wasn't the technology in the shoe; it was the social network. Mm-hmm. And I think this is what's kind of missing from this, a lot of the solutions. It's what challenge or problem are we really solving? It's not can we measure X, Y, and Z. Mm-hmm. It's how can we empower the consumer to do something that actually has been historically tough to do, and or it wasn't necessarily, there wasn't a fun element to it. So in diabetes management, figuring out better ways. The industry, the blood glucose meter industry, has spent the last 30 years trying to figure out more and more accurate blood glucose meters, and claims one year over the next is my meter is more accurate than yours, and frankly, the industry doesn't care. Mm-hmm. And even the clinical side, if you look at the literature, they don't care either. So it's kind of they've been pursuing, I don't know why, 4 of the largest companies in the world have been pursuing a strategy that nobody seems to actually care about. At the end of the day, when we actually see what the diabetic patient actually needs, they need care coaching. And the question I think that has to be answered is, how do you get a vetted care coaching solution that people can trust? So we've seen one example starting to build that brand around WellDoc. Mm-hmm. It's gotten through the FDA, it's getting clinical efficacy trials out. Right. It's getting confidence in the market that this actually makes a difference. I don't know how fun it is. I don't know if they've got that factor entirely built in. And I don't know if they've got the social networking element, which I think is actually an important part of, can you team diabetics together to actually manage as teams if they want to? Ice cream
together.
Yes, exactly. But I think we will see these examples where the real problem isn't measuring something, the solution isn't measuring something, it's actually causing the consumer to be engaged in a way where they believe they're empowered and are now self-managing and actually don't need their healthcare professionals as much as they perceived they need in the past. If you get that kind of mix going in the formula, I think you're starting to move down on the right track. Do we need 45 million fitness apps? No, there's not. Obviously that's an exaggeration, but there's too many. This goes to there's only so many buttons in your life that you're willing to tolerate. So at the end of the day, though, a lot of the fitness apps talk about what they're measuring. It's a heart rate monitor. But at the end of the day, what people really want is, so once I know my heart rate, that's kind of cool, but what is it I really want to know? Do I want to know if I can manage it down? And if so, what does that gain me? And it's kind of, what do I gain out of this offering that is often kind of missing in what at least walks in our door?
So you and I both see thousands of companies, I bet, in a year, or talk to hundreds of companies in person, and the jargon in this field is legendary. And I'm just wondering, what's the one thing you never want to hear a company say again when they come talk to you? What's the jargon or the phrase or the thing that you just stop?
We're improving quality. Believe it or not.
Okay.
And the reason I say that, it's probably a little surprising, is healthcare doesn't know how to measure quality. And there's no index to measure it against. So in and of itself, we can do this and we can do it better, and it actually improves the quality. In and of itself has, in my mind, does not have a lot of meaning to it. Now, if you can figure out a way to index it in a way that the buyer can actually understand how that quality is really measured and they can get some value out of it, then maybe it's okay. But in general, we hear 100 companies come in, their first claim is we're improving the quality of this, and the problem is there's no real easy way to measure it or index it. We're in an environment where we have, for example, in spinal fusion surgery in the US, more than 1,000-point difference in the likelihood you may get spinal fusion surgery in one market versus another. We can't tell what's quality. We can't tell what hospitals are quality. We can't tell what physicians are quality. There's no measurement tools, and this is going to apply to these tools at all. So I'm much more interested when I can say I can solve a problem. I can make you more time efficient for a physician. That's a key selling point. Now you may be able to wave a quality flag. You may be able to say, and by the way, this is higher quality, but a purchase decision is not going to be made there. A purchase decision is going to be made on how does this improve my life, my lifestyle, or my life in the sense of does it save me time? Does it make things more convenient for me? Does it make my life better because I get information, I feel more peace of mind? But does it improve quality? It seems like a lost cause.
For me, it's meaningful use. If you have to argue over what's meaningful, it is meaningless at a certain point. I can't stand to talk about that anymore. So last question, we have 30 seconds here. What is the single coolest digital health app you've seen, market size regardless?
Well, it's one I got involved in a number of years ago, and we just came out publicly and started showing it. And it's a small consumer electronics reimagining of a medical device. So the medical device happens to be an expensive box that was designed and built by a very talented team to use non-X-ray based technology to digitally image the breast for digital breast exams. And we looked at the technology and said that technology could be reimagined as a consumer product that a woman could use at home. And could be done instead of for $15,000 to $20,000 of parts, could probably be done for $200 or $300 of parts. And so we actually helped the company reimagine their product that way. And the reason why I like that is, number one, it addresses a huge problem. Number two, it's a huge multiple orders of magnitude cost reduction, potentially from alternatives. Number
Don't
three,
say it improves quality. I won't listen to you.
Number three, there's potentially a very, very large market globally, and the things that are interested to us, those of us that are in infrastructure and that are biased for we're interested in things that can be driven throughout markets at very large volumes, and so obviously that's a big market at the right kind of price point, at the right distribution channel, might be an interesting product. They haven't gotten traction yet. In fact, the product, while the $20,000 box was FDA approved, the reimagined box that we helped them come up with, which now looks like a consumer product, still has to go through FDA. But that's the one I'm more excited about in terms of showing market potential.
Cool. Thanks. Nice talking to you.
Thank you.
Yeah, if there's questions from the audience, we have a minute or two to answer any questions. Dan?
Great listening to you guys. We're at a digital health conference, so we've got to ask the question, is gamification a euphemism for behavioral economics?
Oh, that's the other word I hate to hear. Oh, God. I don't know. Gamification feels like a way of trying to turn the undelightful to delightful, but it's, I think it is of short, consequence. I look at my daughter who plays video games, all this Zynga stuff like everybody else, and by the time I finally get around to playing it with her, she goes, "Oh, Mom, that game is so, last week." So I really worry about that whole thing, that gamification idea.
I think it's an interesting element. Many companies should explore applying some elements of game theory, and there certainly are some opportunities to apply game theory. But I do think they do have kind of a limited shelf life. I think one of the more fun games I've seen here recently comes out of USC, where it's designed for young kids with type 1 diabetes, and it's a game about the little kid is a vampire, and it's like Farmville, only you get rewarded for collecting blood. So it's got all the right elements. The parents are kind of queasy about the idea, but the kids love the idea, but it essentially is in the behavioral changes, measuring your own blood cool. But will that last? Is the kid going to play that years on
Vampires
end?
come in and out every 20 years. I
Yeah.
don't know.
But will it get them potentially? Is it a way of getting started into a behavior? Maybe. So I think it's absolutely. I'm a big fan of it. It's worth exploring game theory. But I think just like the game industry, you're going to be you have to recognize that if you're going to apply games to your medical device, you're going to be a game manufacturer in the sense that you've got to come out with a new version constantly. In other words, you can't think of this as, I made my medical device and now it's going to be on the shelf for the next 14 years. That's
You
not
either
going
need
to work.
major sports endorsement or lots of killing to make it popular.
But the game theory element of, is my device, does it delight people? I think that's what's going to cause some people to be interested in exploring a new product or service that they might not otherwise explore.
We have a question here right in the front.
Yeah, quick question. Very exciting to be at the forefront of all this and be part of the genesis of this whole digital health movement. What's the world going to look like when this is a mature industry? What's the future look like?
So, great question, and one I actually just spent 2 days trying to answer for the World Economic Forum with a group of folks. I think we'll end up with kind of a world of highly specialized medical facilities, hospitals that are dealing with heavy-duty procedures, surgery, trauma, that sort of thing. And a lot of the mundane health care will be shifted to both lower-level healthcare workers and back onto people themselves that will be armed with technologies that will make life easier. I can easily see phone-based or tablet-based applications that are essentially diagnostic applications where you go through a series of information, you get a diagnosis. It's probabilistic in nature, which is the way differential diagnosis is done anyway. That sends a message to a vending machine that spits out the RX you need. And over the course of 30 years, I think we'll actually have that kind of solution in a half a dozen years. Whether we adopt it in places like the US right away is a different question. But I think the idea that you can do self-diagnosis for routine care and you can cut out some of the middlemen, so to speak, and get fulfillment of some of the, say, basic pharmaceuticals, which will be frontline, that can be simplified. And we'll see a lot more of that.
I also think the move to put the consumer closer to the front of the decision-making process in healthcare, and particularly in insurance, is real. I think that we'll find out what the Supreme Court does with the ACA, but assuming that we actually do move to a world of health insurance exchanges and employers decide to get out of the insurance providing business and consumers are forced to and given the opportunity to buy their own products, you'll start to see much more commercial, personalization, customization, targeted insurance products that drive targeted medical interventions, drive specialized health plans, specialized provider organizations to serve those, whether they're ACOs or not ACOs or whatever the acronym du jour may be. But I think that leveling of the playing field among patients and payers and providers is happening. The power is shifting around somewhat. And law or no law, in the U.S. anyway, I think we're seeing big changes in the system that are permanent.
And I think that will come. You'll see a stratification of the market in terms of hand-holding, kind of a more elaborate version of concierge medicine. So you'll be able to buy into plans that are more customized. So you'll have the Ritz-Carlton version and you'll have the Motel 6 version in terms of services, but there'll be a stratification so you can actually buy more hand-holding and frankly even effectively more luxury in the process. And it'll be disguised as luxury because it includes your gym membership and your genomics and all kinds of other things, but there'll be elements of...
There'll always be guns and whiskey.
There'll always be guns and whiskey.